Appreciate joining. I am Amanda Slater, one of the Assistant Deputy Directors here at the Department of Health and Human Services. Appreciate you joining us today. For those of you that are new to this quarterly providing meeting, just want to do a little bit of housekeeping. We will have representatives from various operational units within the Department of Health and Human Services provide some updates, and then have an opportunity for questions and answers at the end of this. You can ask questions relevant to what they present, or if you have any other burning questions. For those of you that would like to use closed captions, we do have a live transcript option at the bottom of your Zoom window. If you click on that, you can enable closed captioning. Additionally, this meeting will be recorded for those of you that are unable to attend, so you can go back and review this later or share it with your colleagues. One other thing, the email or the recording will go out to you via email, so you can find it that way. Additionally, we do appreciate questions submitted ahead. This meeting is for our contracted providers, so we want to make sure that we are spending the time addressing those items that are most important to you. So please go ahead and submit your questions prior to the meeting anytime. Josie will go ahead and drop that email in the chat, but it's DHHS_CQI@utah.gov. So with that, we'll go ahead and get updated get moving forward with our agenda today. First thing, just wanted to give a notice. Some of you may have already received emails from the operational units that you work with, but each year, as required by statute, DHHS holds a public fee hearing to address any of the fees that we charge to the public. The fee hearing is this week, Thursday, September. Wow, I went back a month. October 16th from 1:30 to 3:30 p.m. So if you have any questions or concerns about the fees, you're welcome to attend that fee hearing. It's held here in Salt Lake at our multi-agency state office building, or there's also a virtual link that you can join on. And the fees are posted along with the public notice on the Utah Public Notice website, and we will drop the link directly to that in the chat as well. With that, I'm going to go ahead and turn this over to our operational units in order. First, I'm going to turn it over to you, Carrie.
Thanks, Amanda. We just have one quick announcement. So the Office of Service Review in September held our first quarterly new provider virtual meeting. As a reminder, this meeting is just really a chance for us to provide extra support and resources to our new providers that are entering into the system, and to receive targeted training, learn about available resources, and to be able to ask questions of specialists from Office of Service Review and other operational units. We will be holding these quarterly, so our next one will be December 2nd at 1 p.m. and we'll be sending out an email with the link to join that for any one of you who are interested. And we would love to be able to target this virtual meeting and training to what you all need. So if you have questions or topics that you'd like us to cover, please go ahead and submit those. We'll drop the link in the chat or the email in the chat that you can email those to, so that we can get those answered for you for that meeting. So hopefully you can all join us for those that if you're interested. And again, that's December 2nd at 1 p.m. And that's it for me, Amanda. Thank you.
Thank you, Carrie. We will go ahead and turn it over to the next one, which it looks like we've got Chanel. And Chanel, before I turn it over to you, I'm just going to give a quick reminder. If we will please introduce ourselves and who we work, which operational unit. I know sometimes there's new people on the call and may not be familiar with all of us. So Chanel, with that, I'll kick it to you.
Thanks, Amanda. So I'm Chanel Long with the Office of Substance Use and Mental Health, and I just have a quick update. So Brent Kelsey, who is the director of our office, retired September 5th. Currently, we have Eric Tadahara filling in as the interim director until we can get that position filled.
Thank you, Chanel. And with that, I will be turning it over to DSPD, but now I'm not seeing any of our DSPD folks here on the call. So, Josie, if you will make sure Dean, Angie, or Marcy are promoted, I believe they were planning on being here today. Oh, it looks like we've got Angie right there. So I will.
Just got promoted. Thank
There
you.
you go. Sorry, Angie, for that delay. So
That's
I will go ahead and turn it over to you.
okay. Hi, I'm Angie Pina. I'm the director of the Division of Services for People with Disabilities. Just a couple of announcements. We have our change management contract that's now in place. They've started working, and we've invited partners to be part of the steering committee. So we have a few representatives from our provider system and from our support coordination system, along with families. So if you are interested in being able to like give feedback, please reach out and we can let you know who your the representatives are in your area so that you can be sharing with them. This contract is really focusing on how to strengthen and improve our system to mitigate abuse, neglect, and exploitation. So, what are some of the processes that we can do to make it less likely to have anything happen, as well as focusing on the needs related to employment supports for people with lived experience. So we're really looking forward. We're super grateful to everyone who agreed to be on that steering committee. We really need your voice. So thank you for participating. It is a pretty big time commitment. It's twice a month for six months. And so I appreciate the time that you're willing to put in for this. And then just a reminder to all of the DSPD contractors that we have that collaborative safety webinar at 1 o'clock this afternoon. So it's right after this meeting. You have an email with the Zoom link to be able to participate. So just a reminder that you have that so that you can find it and make sure you're there. So that's all we have. Thank you.
Thank you, Angie. I appreciate that update. And then I will be turning it over to the Division of Licensing and Background Checks. I believe Shannon, you will be leading out on that.
Great, thanks, Amanda. Hi, everyone. Shannon Toman Black. I am the director for the Division of Licensing and Background Checks in the Department of Health and Human Services. Just a few announcements today. For those of you that are in our human service programs, which is likely most of you on this call, you should have gotten an email from us from Division of Licensing and Background Checks, letting you know about our proposal to raise 13 fees in our human services regulation or licensing program. The email kind of explained what was behind that, but just quickly for those of you who may have not had time to read it yet, we underwent a fee analysis this year because statutorily we are required to set fees to cover the cost of our licensing activities to keep providers licensed or regulated and in compliance. And what we found is that we had a number of fees that were not meeting that statutory charge. And in order to try to approach this in a way that would be sustainable for our providers, rather than trying to raise up to 100%, we identified 13 fees that had not yet were not yet meeting 60% of covering the cost of the licensing activity. And those 13 we adjusted up to that 60% of the cost of licensing activities. So this will allow us to maintain adequate staffing ratio or levels, to improve our response times for complaints, inquiries, and to be able to conduct timely inspections, efficiency, and ensure that compliance and quality across the board. So just for those of you who may not have had a chance to read that, just to give you a heads up there. Also, just wanted to mention that some of you may have already experienced, we, about a month and a half ago, implemented a formal TA process within the Office of Licensing. And what that means in short is that for those of you that may have a non-compliance or an inspector or one of our licensors is out either on a regular inspection or for a complaint or incident inspection, and they identify something that would normally be a non-compliant, but it is of a low or moderate risk, and it has not been a finding in the previous 36 months, we have the option of, rather than citing a warning or a non-compliance, to instead offer formal technical assistance that will be documented for that first time. We have, one of the reasons we implemented this is because we recognize when we look at best practice that often being able to do some technical assistance can have the effect in the long run of helping providers understand what's behind the requirement, why it, how it connects to health and safety, and enables the provider to sustain that that compliance. So just wanted to give you a heads up on that if you have not had a chance yet to experience that. And then we had a number of statutory changes in the 2025 legislative session. And as you know, we have, while those statutes go into effect in the date that generally it's in May, some of them have a longer implementation date. We have, it's 120 days, don't quote me on that, to get our rules written and then posted on the Office of Administrative Rules site for the public to review and give a comment on. And all of those are either posted or in the process of being posted for that statutorily required public comment period, which is at a minimum of 30 days. And you should always get a notice to the emails that are in UCLAP. So if your email is not in there for your program, then it may be someone else in your organization, but should get an email that just notifies you and says that this has been posted and kind of prompts you if you have any public comment to give that. That, I believe, is all of our updates, unless, Daphne, you have had something come up since the last time we chatted.
Have anything today, so we'll turn it back to Amanda.
Thank you, Shannon. Thanks, Stephanie. So those are our updates for today. We do have representatives if you have questions from various OUs here. We have the Procurement and Contracts Management. We have Child and Family Services, Juvenile Justice and Youth Services, Medicaid Long-Term Services and Supports, Office of Coordinated Care and Regional Services, in addition to those we heard. Hopefully I didn't forget anyone. I'm looking at all of our panelist faces and I hope I got everyone there. So feel free to drop any questions in the Q&A part. Before we do move over to the Q&A, we do want to get some information just to make sure that we're keeping these phone call or these webinars useful. So we're going to drop a couple poll questions. So the first question we are going to ask is, how often do you attend the webinar? What do you feel is the most useful? And then what divisions are you working with the most? We recognize that a lot of our various divisions within the Department of Health and Human Services host webinars that are specific to those individuals that they serve. And so we want to make sure that we're not duplicating those efforts. If you're already getting the information in another format, we want to make sure that we're not wasting your time and that these are valuable. So please respond to that poll. That will be very helpful for us. We'll leave that up for just a few minutes so you can respond, and we'll go ahead and pivot to our Q&A. I'm going to actually take the first two questions that we received ahead of time. The first one was, I really want to attend these meetings, but I find that more advanced notice to when they're held would be possible. Is there a way to notify of the meetings earlier so that we can get them on the calendars? So we can definitely look at sending out the invite earlier. I know we try to do the 1 week so people don't forget, but we can try to send that out a little earlier for reference. So you can put these on your calendar right now to just hold, and we'll send you more information as it comes available or as it comes closer. Is we hold these meetings quarterly on the second Tuesday of each month from 12 to 1. So quarterly, that would be January, April, July, and October on the second Tuesday of that month from 12 to 1. So you could just put those on your calendars now. So that was the first question we had. A second question we had was asking if we could move away from encrypted email communication. We will not be moving away from that. We, in a lot of our emails, are actually talking about a client's identifying information or their family's identifying information, and email encryption is the best way to start with protecting privacy and security. A lot of the individuals that we're speaking about, that information should be protected, whether that's under HIPAA or protected information. There's a lot of, I think 29 different privacy things that or privacy laws that apply to the Department of Health and Human Services. So that is why we use those encrypted email communications. And we would expect that providers use those as well when they are discussing client information. So with that, that's the first two questions I have. I am going to go ahead and turn these over to, I believe, Carrie. I think the first question is for you.
Thanks, Amanda. Okay, I'm just going to read it and then read the response. So, lack of guidance and point of contact for new providers. As a new provider, I have found it extremely challenging to navigate the system due to the absence of clear guidance. There are multiple departments and different websites for different functions, and it's not clear who to contact for specific questions. Having one designated point of contact or onboarding resource for new providers would be invaluable. Currently, I often learn by trial and error, though not through training or structured support, which creates inefficiencies and confusion. And just first of all, I just want to say thank you for that feedback and the experience that you've had so that we can look at that and improve our processes. So one of the things that the Office of Service Review is currently working on, I mentioned the provider call that we're doing that's specifically targeted towards new providers that we're doing quarterly. So there's a place that we can share information and people can log on to get to ask specific questions. But we are also in the process of updating our review process, which will include reaching out to new providers with resources and support once they secure a contract, and then again soon after they start billing. And as always, new providers can reach out to, and we'll drop this in the chat, but we do have an email, DHHS new provider at utah.gov, to get assistance from this team. And we're happy to just, even if we're not the ones that can answer, we can definitely get you pointed in the right direction for who can answer that question. So it's a great place to just send questions to, and we'll try to direct them to the right places. Also, for the DSPD 91172 providers, the OSR team, I should say, the Office of Service Review team works with them through the required pre-solicitation process, to the contracting process. So that's another point of contact that you have. And then we are also notified once an agreement is approved. And that, again, as I mentioned, that team works to reach out the first several months to share those resources. One other thing that the department has done is we've added procurement workflow charts to the website, the purchasing website. And this is an attempt to just help you navigate the procurement process when you're trying to secure a contract, and to just know who you need to work with and what steps are involved there. So those resources are added for most. We're still adding some for others on there, but they are already on there for a lot of the contracts that you can access and get to. So hopefully with those few adjustments, this will help with some of that confusion, and we'll continue to evaluate our processes to better support our provider system. Thanks, Amanda. That's what I've got.
Thank you, Carrie. I appreciate that. I will go ahead and I am going to transition to Angie. It looks like we got several DSPD questions ahead of time. So I will go ahead and kick those over to you if you want to read and answer those.
Thanks, Amanda. And it looks like they're all related to our ISO, so invitation to submit offer process. The first one says, lack of ISOs for my county, Wasatch. In over 3 months, I have not received a single ISO for Wasatch County. Could you please confirm whether my business location is correctly entered in the DSPD system? If it is, does this indicate that there have been no ISOs generated for Wasatch County during this period? So if you could reach out to Amanda Barr, which is ABARR at utah.gov, to confirm your contact information, she can validate it for you. And it is possible that there have not been people looking for the services you're providing in Wasatch County. The ISOs are sent out to just the one provider list that has every provider on it, no matter the location. So please note that while it may have a county on the subject line, please open it up to see if they're open to getting services in other areas as well. So that's just worth doing a double check. The next question is incomplete or poorly formatted ISOs. Says many ISOs arrive missing key details. Sometimes fields are cut off, narratives incomplete, or information too general to evaluate. This makes it difficult for providers to assess fit and respond efficiently. Is there a quality assurance process to ensure ISOs are complete before distribution? We're actually currently focusing on our ISO process. We've engaged families, providers, support coordinators in this process to figure out the best way to share and get information back so that it is efficient. While incomplete sentences are a quality issue, the other part of this issue is finding the right balance of sharing enough information and not sharing so much that you could potentially identify the person, because that then becomes something that compromises HIPAA. So we have work groups focused on this, and we're engaged currently on improving this process. So thank you for bringing that up, and we are paying attention to it. The next one is lack of response from ISO contacts. Despite reaching out to the listed ISO contacts, I rarely receive acknowledgements or responses, not even a simple not interested. Could DHHS establish a policy requiring coordinators or agencies to confirm receipt of provider inquiries? So each ISO response does go to the support coordinator, and they work with and support that person or that family. The family then determines who they want to interview and ultimately who they select for services. This can be a pretty overwhelming process for families. Each ISO could generate multiple responses, and there's not a time limit on when a person or a family makes their decisions or how quickly they engage with agencies who have responded to their ISOs. And they may also need room should an initial provider they select not work out. I think this is a scenario where like we work with humans, we contract with humans, and we need a process that's flexible enough that it's flexible enough for our contractors as well as who we're serving and their families. And while it's not perfect and you may not hear the not interested, it is really around how do we best support a family to figure out like the right services and the right fit for them. And as I mentioned, we have that ISO process improvement that we're engaged in right now, and we've been getting feedback from provider support coordinators and families on processes there as well. The next one we have is misdirected ISOs, so minors sent to adult providers. My business is licensed to serve adults with disabilities, yet I often receive ISOs for minors whom I am not authorized to serve. Could this be reviewed to ensure that ISOs are only sent to providers appropriately credentialed for the individual's age and service category? So it is true that a license needs to be accurate for who you're serving, a license or a certification in our system. Um, a contract with DSPD allows you to serve both minors and adults. So the contract allows you to do both. You would need to get a license if you chose to serve someone who is a minor and you currently are only licensed to serve adults. But we find that many providers have interest in broadening who they serve. And the ISO process is based on the contract rather than on the license. We typically put the age of the person wanting services in the subject line, so there's an easy reference to age for you to screen that out. And at this time, we have one provider list that we send the provider ISOs to, and it doesn't differentiate between service ages or location at this time. Okay, I will pass this back to you, Amanda. I see we had another question come in, but I need a minute to look at it.
Yeah, no worries. I'll give you a moment to catch your breath there too. Thank you, Angie. So with that, Shannon, I'm going to go ahead and kick a couple to you. And I'm not sure if you or Daphne will be taking them, so I'll just let you lead out.
Thank you. Amanda. 1 second. So for our first question, I am going to let Daphne take this one, and then I'll step in for some of the other ones. So this question is, have you thought about training each provider to complete the renewal BCIs? I'll let Daphne go through the acronyms here for their organization. Once the paperwork is completed, a reviewer from the state can make sure it's properly filled out and turned in. That might help keep costs down and help to complete the BCI renewals in a timely manner. So Daphne, I will let you go ahead.
Oh, and to clarify, BCI generally stands for the Bureau of Criminal Identification, which is a department of the public safety that we send ours to. We'll just keep it simple and just always refer to them as background checks. But as far as background check renewals, there is no paperwork that need to be completed. And I'm going to say we do recognize that we can provide more technical assistance in this area for how renewals need to be completed, and as a provider, what your steps need to be and what your responsibilities are. But really, when a provider first submits a background check on a brand new employee, the employee is enrolled in the FBI RATBAC system. So our office, the Office of Background Processing, will get a notification of any new updates or records of arrests or prosecutions. This means that we don't have to spend so much work searching on a renewal, because we're going to automatically receive any of those updates to then be able to take the necessary actions to ensure the safety of the populations. But there are still name-based searches that we do need to complete on an annual basis. And in order for us to have the authority to complete those searches and to verify that information, that is what we are asking you, the provider, to do. And that's what we are asking you to do when you are verifying your roster, is ensuring that these employees are still associated with your program, and that we have that authority to still have them on FBI RATBAC, as well as to perform these searches for this. And so that's when you verify them in the DAX system, that is why we are currently asking you to email us that you have done that verification, so that then we can process the renewal, and we are processing those renewals in the order that they are received. If you have done these steps as a provider and we have not actually updated the direct access clearance system with this information, there will be no licensing concerns or negative actions, because you have done your steps while we are still completing the work. And we are trying to address these duplicate steps through system development, so that you will not have to be emailing us when you have verified that the employee is still associated with your program.
All right, thank you, Daphne. Excuse me. And we've got another question here, and this is about deemed sites for substance use and mental health providers that serve only adult populations at that site. So this is in the past legislative cycle, the 2025 legislative session, 26B-2-110 was enacted to allow certain accredited adult substance use and mental health providers to become a deemed site and opt out of licensing renewal inspections from DHHS. The question is, how do we go about becoming a deemed site to opt out of the renewal process? We got this email actually a few months ago, so hopefully everyone has gotten their information on how to do that if it applies to you. However, I'm just going to take a minute to kind of go over the basics of this. There will be a rule that will be posted for public comment here pretty soon, so you can see some more specifics. Right now, because the statute is in effect, we are basing it off of the statute language. So I just closed the link that had our process. So one moment, let me reopen. And I will just say, yes, this is being recorded. I just saw that pop up, so I can give that answer. All right, so a deemed site, just for definition's sake, is a site that's operated by a licensee that has been approved by the department to be a deemed site. And then good standing is defined as the licensee has not had a violation that is considered by the department as moderate, high, or extreme noncompliance in the previous 24 months, does not have a finding by the their accrediting organization that would be the equivalent of a moderate, high, or extreme noncompliance in the last 24 months, and does not have outstanding fees or civil money penalties owed to the department. So if you are accredited, you can submit a change request form in your provider portal. And let us know that you have been accredited and you would like to pursue becoming a deemed site. So that's the first step. So in your change request form is basically the form you use for any change to your site. In this case, it's like a change to a license type. So to be eligible, you have to have a DHHS human service license as an adult substance use and mental health provider. You have to be in good standing. You have to be accredited by a national accrediting organization as identified by DHHS. Right now, those are, your main ones that you guys are all using, and we will have a process for if you think there's an accrediting organization that's not included on that list, you can reach out to us and we can look at adding that if appropriate. The thing to remember is you are still subject to all licensing fees, whether we come out to do a renewal inspection or not. And we will still come out to do investigations of complaints or incidents. And so when you, after you submit your change request form, you'll need to submit the following documents, which are any inspection reports, findings, and plans of correction issued by your accrediting organization, progress reports on any plan of correction required by the accrediting organization, and written intent to opt in or opt out of on-site renewal inspections conducted by the department. Because you can be a deemed site and decide you still want us to come out, and we are more than happy to come out to do those yearly renewals. But this will also allow you to opt out on those yearly renewals as long as you still have deemed site status. One thing that we did have some questions about, so just wanted we were going through the process, and this is in the statute, is we will not share your accrediting information with other people. That is for our use to be able to see if you qualify as a deemed site or if we need any changes have to be made. We're not going to post that information on your public provider portal or anything like that. Your accrediting information is just for use in the process of us looking at if you qualify to be a deemed site. We'll process the application and verify that we've got all the documents. We'll document that it's been received, send you an email letting you know we've gotten it. And if we're missing anything, and it's after it's verified these documents have been received, then our process specialist sends that to our program administrator, and he at the time it is a he, will say yes, it can be a deemed site, or no, there's some issues we need to talk about more, and we will notify you. And if for some reason the application is denied, then you can always appeal that decision. So that's just kind of some basics, but there is a revocation process. Obviously, if there is a finding that happens or any of those things that keep you in good standing, do not are no longer the status. But just clarify, it is site specific. So just because there might be a finding at one site doesn't mean all of your deemed sites that are run by your organization are suddenly not deemed. So yeah, that's kind of the quick and lowdown on that. If you have further questions, please reach out to Dustin Penman, who is the program administrator for our human service programs. And we'll drop that email in the chat in that name, and he should be able to get you some more information there. Next one, I'm going to throw back for you, Daphne. And this is our renewal for background checks are months behind to be completed. Is this going to be caught up anytime soon? Tell us the tea, Daphne.
Great, thank you. Okay, I'm excited to say yes. We are excited because we are starting to get caught up on these renewals, and we do admit that we are months behind in this. With the refining of the initial process and the updates to that this July, we're really focusing on prioritizing initials. And in doing this, we wanted to ensure that we could maintain these new timeframes for initials, because I know in years past we've said, okay, we got caught up, but then we always fall behind again, and then we get caught back, but then we fall behind again. So we want something that is sustainable. And so we have found that this process is going to be more sustainable with initials. And so now we are really working on tackling the renewal backlog. This still may take a couple more months to complete, but we have already started on getting these renewals caught up. And so we are hopeful that it'll just take a couple more months before we are all caught up on these renewals.
Thank you. All right, we have 2 more questions, and then you can hear somebody else drone on. So I have a specific question for the Office of Licensing about what rules and regulations exist for providing on-site childcare for events such as a conference. Who should I direct my questions to? Great question. So first, I want to let you know that you can find all childcare rules on our website at a link that will be dropped into the chat. And for contact, you can also contact Crystal Nippers, who is our child care program administrator for the Office of Licensing, and her email will be dropped into the chat as well. Then, final question at this time is, I have a friend who owns a new therapy agency that was trying to get licensed for substance use treatment. He was told he didn't have to be licensed to provide substance use treatment. I thought this was odd because we had to go through licensing. Will you explain who has to be licensed through DHHS to provide substance use treatment? If you have about 3 hours where we can sit down and go through all the license types, I can get into the details. But in short, whether or not a provider must be licensed is really dependent on the types of service they offer, where they are offered, and the population the provider serves. And that is really provider dependent. But the rules for the regulation of providers offering substance use treatment is found on our website, which has been dropped into the link. And if a provider needs specifics on their program, they can reach out to Dustin Penman, who is our program administrator for human service programs. And his email is in the chat. Amanda, I'm going to kick it back to you.
Yeah, thank you, Shannon. And I'm just gonna, before we go to another question, just remind you all, if you have a question, please put it in the Q&A section of this, not in the chat. I'm afraid that putting them in the chat, people may miss them because we are all watching the Q&A section, trying to make sure that we get those divvied out. So just wanted to please ask that you put them in there. That way also our communications will capture it. So if we miss something, we can follow up with those answers as well. So with that, I am going to go ahead and pivot back to you, Angie, for one of the live questions. It says our new contract, DSPD, states that we need permission to use AI. I have a BAA for HIPAA compliance with Google that includes Gemini. Who do I ask for permission?
So first, thanks for the question. Please remember that a BAA only governs PHI, so public health, private health information, right? So that's the only thing that a BAA, a business associates agreement, governs. I'm following up on the best place to send this request, and we'll get that out to you with this recording. So I don't have it today, but I'm following up to get you on that.
Perfect. Thank you, Angie. And then I'll take this one question. It says there are always so many changes. What is the best place to get updated DHHS org charts and contact information? So I am going to have Josie drop in the link, our DHHS website that does have a link to our org chart as well as all of our divisions with those contact information, so that you can always go and look up that most recent org chart. Thank you for that. I'm going to go ahead and let me see, trying to make sure we get all of the questions here. Oh, Angie, it looks like we've got another one for you. In regards to the ISOs, I was going to spell it out and then I just lost the acronym. So I don't remember what that is. So you can
Invitation to submit offer.
Invitation to submit offer. I personally feel like there's favoritism that is happening with support coordinators and preferred providers. How do we know that equality and fairness is happening? We don't, because like the question before, are no responses to ISOs out of a courtesy to providers. The support coordinator seemed to be the only person who is not under any microscope. Oh, I think you just muted Angie, if you'll get that one.
Perfect timing. Okay, thank you. So anytime there's a concern about choice, please reach out to our constituent services team. They focus on the people we serve and assuring choice and protections. Anytime we get a concern, they follow up with that person, they'll follow up with that family. Also in the National Core Indicators Survey, that it's often called the NCI survey, we do look at choice of services were offered, including for the SCE reviews. That survey is done by the Office of Service Review team, right? So it's an outside party looking at that and following up. While it is a sample, it is one of the methods we have of assuring choice for people. And we definitely, right, we expect everyone to be promoting and supporting choice and prioritize the people we are serving.
Thank you, Angie. Shannon, I'm going to take a question to you real quick. what is the turnaround time for a deemed status license once all documentation is submitted?
Great question. So our turnaround time that you should expect is between 30 and 60 days. We try to aim for 30, but can allow for up to 60. In some isolated cases, it may take longer, but that is usually if we are working with the provider on getting the appropriate documentation. But since your question was around once all the documentation is in, I think it's 30 to 60 days what you can expect. If it goes longer than that, please absolutely reach out. Again would start with Dustin Penman, whose email is in the chat. And of course, you are always welcome to reach out to me at any time as well.
Thank
Oh,
you,
sorry,
Sherry.
I just was seeing if our other question was ready to be answered yet, but it is not. Bring it back to you.
Yeah, no worries. And I know that there is a question there about is the government shutdown impacting BCIs. I believe Daphne is trying to do some background look. So hopefully we'll get an answer to you before this call's done. But at this point, I don't think that we're aware of one. I'll go ahead and just take another answer or take another question. There was a question about, is there any delays in provider reimbursements due to the federal government shutdown? I will ask anyone to feel free to correct me if I'm wrong, but at this point, we are not experiencing delays. The Department of Health and Human Services is continuing to operate as usual. If for some reason the government shutdown continues to go on longer and longer, hopefully, we're all hopeful that we will get that figured out sooner than later. But if so, we will communicate if there are anything that disrupts services. And I will pause. So if there's something I'm not aware of and anyone wants to jump in, but as to my knowledge, we are operating as usual. Okay, nobody's jumping in. So nobody's heard anything that I haven't. At this point, everything's working from the state perspective well. Let me just see here. We're getting close to it. So let me see if we have any other questions that have come in. There was a question about the recording. When after this call recording is done, we will send a email out with that recording linked. So you will be able to get that. All right. All the rest of you, did I skip any other questions? Let me look here.
There was one about the Kentucky model for DCFS, but I'm not sure what that's referencing. So if whoever submitted that happens to be on the call and wants to provide a little more context for me, I would be happy to chat about what thing the great state of Kentucky is doing that you want DCFS here in Utah to look into.
Thank you, Kyla. Yeah, I think that that would be helpful. I know there's a couple questions on here about if we answered somebody's questions. I apologize. I would have to go back and look at what was submitted. We just put the questions on the sheet, so I'm not sure if your specific questions were answered or not. Yeah, we'd have to get on there and look at that. So I apologize. I'm not able to answer that right away. And it looks like, Angie, I'm going to go back to another question for you. It says, there are lack of ISOs for my county, Wasatch. In over 3 months, I have received a single ISO for Wasatch County. Could you please confirm whether my business location is correctly entered in the DSPD system? If it is, does this indicate that there have been no ISOs generated for Wasatch County during this period?
Amanda, I think that one was submitted ahead of time.
That is correct, because you answered that, right?
Yeah.
Okay.
And just a reminder, if it came up again, if you want to verify your contact information, please reach out to Amanda Barr, which is ABARR@utah.gov.
Perfect. And I would say if in those ISOs is general, please reach out to that Amanda if you have questions. Amanda Barr, she can help you if you have other questions. I would suggest when you have specific questions about your business being in the system, right? That probably is just the best format, because since this is a provider call, we're not able to answer a provider specific question. So emailing those individuals, I know Shannon's also given some names of some of her leads. So I would definitely say that those contacts are always great contacts to reach out to directly. Additionally, we have the email that we send these from, or you can send questions at any time, which is DHHS_CQI@utah.gov. That goes to Carrie's group in the Office of Services Review, and they will get you to the right person. They're always great to make sure we get you connected. So if you have specific questions, feel free to reach out to them. Let me see. I think we've got kind of a wrapping up to the last question here.
Amanda, I can provide an answer.
Oh, perfect. Daphne's got an answer. Thank you, Daphne.
Welcome. Okay, so again, the question was, is the government shutdown impacting background checks? And I'm going to say we have been experiencing delays in receiving fingerprint results from public safety. We are about 12 days out and waiting for some of those results. And I'm going to say we do experience these delays from time to time. And so it may or may not be related to the shutdown, but I know we were starting to experience some of these delays before the shutdown.
Thank you, Daphne. And then there was a question that came in there about, will Medicaid providers be updated if there are changes during the shutdown? I'm going to answer that one, and then I'm going to answer it generally. And if there's follow-up specifically to Medicaid, I'll kick it over to Joseph. But absolutely, if there are any changes with the federal government shutdown that is going to affect our providers, we will definitely communicate. At this point, we don't have any expected for the short term. But if anything does change, communicating with our providers is always a top priority. So whether that's child welfare, juvenile justice, Medicaid, any providers with the Department of Health and Human Services, if changes will affect you all due to the federal government shutdown, we will be sure to communicate that with you all. With that, I'm not seeing any other questions. So again, we will send this meeting recording out to those individuals that received the invite. Thank you all for joining us, and thank you for those that submitted the questions beforehand. Oh, Shannon, I saw you raise your hand.
Thanks, only because I did just see somebody drop the question in the chat. And it was just asking what Dustin Penman's title was. And Dustin is the Dustin is the program administrator for human service programs in the Office of Licensing.
Thank you, Shannon. Thanks for catching that. I thought I got all the questions, but thank you for catching that. As I said, thank you for submitting the questions beforehand. I think that when we have those questions to prepare in advance, hopefully we can get you an answer. I know there were a couple questions that we'll be following up on, and we'll get those answers back to you all. We just want to let you all know the next meeting will be January 13th, same place, 12 to 1 via Zoom. And ongoing, those are the second Tuesday of the quarter. So look forward to seeing you all at that. In the interim, please feel free to send any questions to us at the email that we've provided in the chat. And we appreciate all that you do to serve Utahns. Without our provider community, we could not meet our goal as DHHS to ensure that all Utahns are able to live healthy and safe lives. So with that, thank you very much and have a wonderful rest of your day.